Well, a typical example of the kind of condition that patients might come to a gynaecologist for are benign conditions like fibroids or endometriosis, which are conditions that are relatively common in the general population and in a number of women will cause no symptoms whatsoever and therefore don't necessarily need to be treated, whereas other women will get a range of symptoms. We see quite a lot of women who you could imagine have a whole range of different problems in gynecology, some of which they've discovered incidentally through screening tests, because there is increasingly women's health screening, so people come with results already, in fact, where they've had ultrasound scans, for example, or they've had other tests that have given what we regard as abnormal results. And many of these patients are well, and what they have to understand or have to make sure is addressed when they see a gynecologist is whether the treatment, the condition they have actually requires treatment or not. Because for many of these things, you are able to reassure people that there isn't any immediate implication for their health, and almost always there's some relatively straightforward treatment that they'll be able to have that's not going to compromise their future fertility, which is obviously a big concern for many women seeing gynecologists. And the other thing is that people naturally are concerned about gynecological cancers. There's been a lot of media attention over the last couple of years about gynecological cancers. So as soon as you see that you've got an abnormal smear result, that's unsurprisingly going to generate a lot of anxiety. So a large part of our role is trying to sort out who really is going to have a longer term problem that needs treatment and who can be reassured.